don't have to read all of this to pass nursing school. Let me show you how to do it. Hello guys, welcome once again to Nurse Kodia's page. Today we are going to be talking about how to study for an exam in nursing school. Has it been a challenge for you? Are you struggling to find a balance? Well, worry no more, okay? I'm going to be giving you some very useful tips. So if you want to know what they are, stay tuned. The first thing you want to keep in mind is that each professor has a unique method of teaching. Now, for many of my professors, what they did is that they created their own notes. And these notes were created out of the textbook content, right? Because when I went back to read my textbook, I realized that they had pulled out the important parts of what was already written in my textbook. And actually, what I was already doing was that I had already gone ahead to read the textbook and make my own notes. And I realized that my notes were very similar to my professor's notes because they were writing the vital points, which was what I was focusing on when I started to read. So if you have a professor that is already making their own notes, I would advise that you focus on that, because making your own notes is kind of like double work, right? You can just make use of your notes, read it, make sure that you understand the content, highlight it. And if there is something that you do not understand from their notes, what you can do is, or what you should do is, open up your textbook to that particular section. Now, I'm showing you how to use your time effectively. You want to open up your book to that particular section that you do not really understand, because the book will expatiate the information for you. It will give you smaller details that will help you understand that subject area that you need help understanding. So, like I said, I want to reiterate. You read your teacher's notes, you highlight their notes, and some professors actually have a very great way of doing their PowerPoints. They're very detailed and they're very specific in their PowerPoints. So you read their PowerPoints also, and the sections that you do not understand, you go to the textbook to clarify it for you. Because if you want to read the whole information on the textbook, it's going to consume a lot of your time. I remember finishing a whole chapter of a subject area in my textbook, and by the time I finished that, I will have read 3 chapters if I was studying effectively. So number one thing you want to avoid doing is wasting your time, okay? And figure out that unique method that your teacher uses to teach, and find a way that can be easier for you to memorize or for you to learn that information, all right? Because a lot of times, actually, the content of your notes has a lot of exam answers. I know that with nursing, they don't directly come asking you what is hypertension. Most likely, they'll give you a scenario and you determine based on the symptoms what the patient is going through, and then you will answer from there. However, the important points that your professor will note either in their PowerPoints and in their textbook, trust me, a lot of your exam questions will come from there. So you want to pay attention to that element of it, okay? You want to read and you want to highlight the parts that stand out for you, or the parts that are already highlighted. Number two, you want to pay attention in class. A lot of students feel that because they are already reading a lot, they're already giving a lot of hours of study outside class time is time to chit chat. You do not want to do this. Don't waste your time in class, okay? Make every moment useful. When your teacher is teaching in class, or your professor, based on where you're watching this from, is teaching in class, you want to go ahead and pay attention, because a lot of times professors mention what they're going to test you on the exam. So you don't want to miss out on important information. It's not time for you to talk with your classmate and try to catch up about what happened during the weekend. If you have your break time, yes, you can go ahead and, pay attention and talk about those things during your break time. However, if it's not your break time, then it's time for you to actually listen in, because sometimes they give you specific tips on how to pass their exams, okay? So you want to do that, and you also want to take notes while you're in class. So you want to read your PowerPoint or your lecture notes, and you want to make your own notes while you're in class, because you realize that even when you're reading their notes, there's some things that they might have mentioned in class that is not on the notes that were already taken prior, or are not on their personal notes that they printed out for the students to use, okay? So it's really time for you to take advantage of. Number three, you want to avoid bulk reading. And by bulk reading, I mean that you want to avoid reading very close to that exam time. If you say that I'm going to read 3 chapters or 4 chapters a week before the exam day, you're setting yourself up for pretty much failure, right? Because how are you going to be able to memorize so much content in just a week prior to the exam or just 2 weeks prior to the exam. You don't want to overwhelm yourself. And a good way for information to stick in your long-term memory is to look at that information over time and to look at it over and over. So now studying very close to the exam time will not give you that space or that time to study ahead of time and look at information again prior to your exam. And if you're not able to store information in your long memory, then you're very likely to do a lot of guesswork during the exam, because it's not content that you can sit down and explain without looking at your book. You should be able to give someone a summary of the system that you're looking at without even opening your book. And then you know that, okay, at least I have an understanding generally about this information. Okay. Um, Also, when you're reading, you want to read based on systems. If you're looking at the cardiovascular, and usually this is how professors teach, they'll teach you based on systems per content area. For an exam, they might be looking at more than 2 chapters, they might be looking at 3 chapters. You want to go ahead and read according to chapters. So you want to make sure that you understand chapter 1, what is being talked about in chapter 1. If it's the cardiovascular system, and if it's the respiratory system, you want to make sure you understand what is being talked about in the respiratory system. So you want to understand each system individually, okay, to a high capacity before moving on to the next system. Another thing you want to do when you're studying is lab values will always come on your exam, right? Your vitals, these are fundamental things that you want to know. You want to go ahead and memorize this because they can pop up in any questions. That's why you take a class called Foundations of Nursing, and where you learn certain fundamental principles that are going to help you throughout nursing school. So the values that you definitely have to memorize because they will show up at any exam. Next, you want to do practice questions. You want to practice questions. If all you do is read the content that has been given to you without practicing questions, especially as a new nursing student, is going to be a challenge to you. You want to make sure that along with reading, you're practicing questions, because what the questions do is they expose you to the kind of questions that you're going to see during exam time. They expose you on how to answer them. It's a similar situation, right? They give you similar scenarios that might come up on your exam. And the more you practice it, the more you practice how to answer questions, the more you get better at answering your exam questions. If you just read, and I made this mistake, if you just read based on your textbook, your PowerPoint, or your teachers, your professor's notes, then trust me, even though you have the information in your head, you don't know how to be practical about it. What questions do is they make you answer the questions in a more practical way, right? It brings whatever you've read into reality, how to apply it to reality. And that's the way NCLEX questions are based. So if you're just reading and you're not doing questions, you're wasting your time. And the way you want to do questions is that you want to do it by subject area: cardiovascular, respiratory, hematology. You want to do it like that. Nearing your exam, what you want to do is that you want to do an accumulative study where you can practice questions together. And I know that the textbooks that usually come with a website where you can go and practice those questions. So you want to do it by systems, and then you want to do an accumulative studying close to the exam time. And you'll be more effective on your exams if you're practicing accumulatively close to exam time as opposed to just studying by systems. Next, you want to watch videos. This cannot be underemphasized, okay? See, you want to read, you want to do questions, and you want to watch videos, because the more you see the same information over and over, you realize that the better you can remember it and the better it can stick to your memory. Okay, so once you're tired of doing questions, you can always go back and watch videos, and especially videos that are detailed about what you've already seen, and you see that you're even understanding the content better by just listening to someone else repeat the same information. There are 2 nursing YouTube channels that I can recommend for you. You have Registered Nurse RN. She's very detailed, and she will teach you exactly, most likely, what you're going to be seeing on that exam. She will focus on like bolded the bolded elements in your textbook. She will focus on vital information that you have to know about the diseases. She will explain the disease processes to you very well. And also Level Up RN, right? And also her cards help depending on what class you're in. She also explains things by systems, and she helps you look at the details of different diseases. And she's also like textbook a savvy kind of person. These are textbook savvy pages that I feel like they relate a lot to what you will see in your textbook. So you can go ahead and check them out. And I'm going to be leaving a link to your channels down below. And that's all for today. Thanks for joining.